I'm very excited because this is something that we've been wanting to do for a long time, is really figure out where the gaps are and who is addressing these. And so Bridging the Gap in the Oral Health Safety Net is our first course this morning. And I'm pleased to introduce our panel participants and the moderator. I'm going to go ahead and introduce all of them, and then we'll go ahead and start with their presentations. Each one will be doing an individual presentation first, and then Dr. Dhar will be moderating the Q&A portion afterwards. And then also, if you've got any questions for these individual presenters, when you write it in the chat box or Q&A box, please let us know who the question's for. If it's for all, you can put all. If it's for one particular presenter about their organization, then please just write a little bit of something, either the organization name or the last name of the presenter that you want the question addressed to. Okay? All right. So beginning with Dr. Roxana Cruz, as the Texas Association Community Health Center's Director of Medical and Clinical Affairs, Dr. Roxana Cruz provides clinical leadership to TACHC programs, education, member support, and advocacy. Her career in FQHCs started as physician and medical director at Los Barrios Unidos in Dallas, moving to work in New York City with homeless populations, and then at Ryan Nina Community Health Center, where she focused her work with patients diagnosed with HIV/AIDS. In 2007, she returned to Texas to work at Community Health Services Agency as medical director. Additionally, she was selected for Rural Health Fellow program by the National Rural Health Association to articulate a clear and compelling vision for rural America in 2015. The next presenter will be Ms. Erica Castillo. Erica Castillo is a graduate of Concordia University of Texas, where she attained a BA in Administrative Healthcare and a master's degree in Business Administration. Ms. Castillo is the Senior Dental Operations Officer at St. David's Foundation. Erica manages business operations for the St. David's Mobile Dental Program, one of the largest school-based mobile dental charity programs in the country. Additionally, Erica develops, implements, and manages the daily operations and strategies of the dental program and dental operations team, which also includes compliance, process improvements, and overall quality. Next is Dr. Michelle Vargas. Dr. Vargas serves as Medical Director of Oral Health Services for Methodist Healthcare Ministries, a faith-based nonprofit organization that helps low-income families get access to health care in 74 counties in South Texas. Dr. Vargas is a graduate of the University of Texas at Austin and Baylor College of Dentistry. She started her career in community dentistry with the San Antonio Metropolitan Health Dental Clinic, and then with Barrio Comprehensive Healthcare, serving on the UT Health San Antonio Dental School adjunct faculty while at both clinics, overseeing students in a clinical setting. In 2000, she joined Methodist Healthcare Ministries and has served her community there for over 22 years, focusing on prevention and integrative whole person care. Nancy Blinn currently serves as the Executive Director of Dental Health Arlington. Nancy has been a registered dental hygienist since 1987 and has worked in varying capacities within the dental field. She has spent the last 30 plus years working as a registered dental hygienist in varying capacities within the dental field, including an 18-month stay in Zurich, Switzerland. You probably wish you were there now, as hot as it is. She specialized in pediatric dentistry and patient behavior management techniques, worked in private practice for over 12 years and at Children's Medical Center of Dallas for 3 years. Nancy is a past president of the Texas Dental Hygienist Association and of Greater Fort Worth Dental Hygienist Society, and has provided continuing education courses throughout the Southwest Dental Conferences, CE Express, and Lunch and Learn series. Our moderator for this panel discussion is Dr. Sohini Dhar. Dr. Dhar completed her dental education in India, where she practiced general dentistry for several years. After moving to the United States, she continued her education in dentistry and public health. Dr. Dhar received a Master of Public Health degree from the University of Texas Health Science Center at Houston School of Public Health and completed her residency in dental public health from the University of Texas Health Science Center at San Antonio School of Dentistry. Dr. Dhar is a diplomat of the American Board of Dental Public Health and is a board-certified public health dentist. She is also inducted as a Fellow of International College of Dentists in the USA section. At present, Dr. Dhar works as an assistant professor at UTSCA at the University of Health Center San Antonio School of Dentistry. She's also an adjunct faculty at A.T. Still University. So it is with pleasure that we start with Dr. Roxana Cruz, and we'll go ahead and you should be, I think we're ready to go. So thank you.
Thank you. And thank you for having me. I'm very excited to be part of this panel, with great colleagues here, very accomplished professionals. So again, thank you. I'm the Director of Medical and Clinical Affairs at the Texas Association of Community Health Centers. We call that TAC for short, as an acronym of TACHC. And we are a private non-for-profit membership association committed to advancing equitable access to quality healthcare in Texas by supporting and advocating for community health centers, also known as federally qualified health centers, or FQHCs, sometimes also called health centers. So TAC is the federally designated primary care association here in Texas, and each state or region in the United States has a primary care association. We assist members in providing high quality, comprehensive primary care and addressing the full spectrum of health center needs so that they can focus on their patient care. TAC also provides members that include the FQHCs and other providers, non-FQHCs, or what we call FQHC lookalikes or interim members as well, to address the full spectrum of health center needs so that they can, and we strive to help them meet the needs for the uninsured and underserved. So members operate and I'll go into more detail about this, we operate in urban, rural, and frontier areas, all with the mission of advancing access to healthcare for all individuals living in Texas. So we do this through equity, access, and quality as our taglines through legislative advocacy and training and technical assistance to health centers. Next slide, please. Thank you. So here's our mission. I can read it out. I think you can read it yourselves. Again, focusing largely on our strengthening and supporting our health centers to speak with a unified voice and drive healthcare transformation through innovation, access, and equity. So that we are unique, our health centers are unique in four particular ways, and I've listed these out. First of all, they must be located in areas of high need. That could be medically underserved areas or medically underserved populations. Also, we have a comprehensive set of services at all health centers: medical, dental, behavioral health, pharmacy, and other support services. This third one is that it is open to everybody, regardless of insurance status or ability to pay. So this is actually critical to our mission, and we offer a sliding scale fee for individuals who are low income. And that's done through an intake. At every time a new patient comes in, they have an intake, a financial intake, to make sure that we are addressing their needs at their level of ability to pay. And that's, again, a sliding scale fee. And lastly, we're consumer driven, which means that at least 51% of every health center's governing board must be made up of patients. So that is actually very unique, and I don't know that there's any other organization that does that as a requirement. We receive, our health centers and TAC receives funding, federal grant funds directly from the Bureau of Primary Health Care at the HRSA, or Health Resources and Services Administration, to support the operation of services of the health centers through their health center programs. So federal grants from HRSA provide about 30% of health center revenues, just to give you an idea of how much that, how important that is to our health centers, so that they can operate as nonprofits. Additionally, FQHCs receive cost-based or enhanced payment for services to Medicaid and Medicare patients. So we actually are mandated to provide care to Medicaid and Medicare. We cannot close our doors as some private offices had to in different times of our healthcare history, but we are mandated to do that, so we will never turn somebody away. We also have access to 340B drug pricing simply because we're a federally designated health centers. And our health centers can also participate in the National Health Service Corps, which is wonderful for not only the providers to receive loan repayment or those who had received scholarships that they can be placed in medically underserved areas as a requirement to the National Health Service Corps. Other support for FQHCs comes from additional state and federal grants, local support, including foundations, which we are very grateful for, and community funding, as well as the 40% of patients who actually are self-paying patients or other patients who are insured. Next slide, please. So again, just to reiterate, FQHCs are community organizations with defined target populations and service areas providing multiple primary care services, which include, of course, as you can see here, medical, dental, behavioral health, and pharmacy. So just to give you an overview, there are 72 FQHCs, 1 FQHC lookalike, and 6 interim members who are becoming FQHC lookalikes or FQHCs. We serve over 1.6 million patients each year, and that's 5.6 million patient visits annually. Next slide. Services are available to children, adults, insured, uninsured, Medicaid, Medicare populations. Excuse me. Excuse me. Again, we are in 137 of our 254 counties here in Texas. So we are in a lot of places. 41% of our health centers are actually rural or frontier. And across the board, there's over 650 sites. Next slide, please. So this next slide shows you just sort of different graphics that we also shared in the Dropbox. I think that you have available as a flyer on just giving the overview of what the health centers do and the demographics for our patient population. We serve 12.2% of the Medicaid population, and many of those receive oral health services, as you well know. What's interesting is that despite the fact that we serve 12.2% of the Medicaid population in the state, it comprises only 1.1% of the Texas Medicaid budget. So we're very cost effective, and we're very proud of this because we operate on very slim and narrow margins, but we make do with everything that we have access to. As I mentioned, 40% of the patients seen in Texas FQHCs are uninsured. So you can imagine that this is where the prospective payment system, or the system of how health centers are paid and how the HRSA provides funding, this is where it complements and supports our health centers so that we can provide those services. Health centers in general treat a large portion of patients with complex medical conditions compared to private practices, and that is a statistically significant point I wanted to make. Nationally, health center patients are 35% more likely to have one chronic condition, to have more than one chronic condition in comparison to private practices. So typically we will be providing preventive care, management of chronic diseases, and of course, acute and conditions, we manage them as well in medical, dental, and behavioral health. Next slide, please. So on this slide, I just wanted to showcase the quality workforce that Texas health centers have. We depend on the primary care workforce and are considered actually the largest safety net group in Texas for primary care, with over 12,500 full-time employees integrated and multidisciplinary clinical care staff members providing high-quality, patient-centered care that is comprehensive, accessible, and affordable. As you can see here, 78% of our health centers are currently nationally recognized and designated as PCMH, or patient-centered medical homes. The importance of that, as you may or may not know, for those of you who are familiar with the PCMH designation, is that it actually can be demonstrated how our health centers work in a team-based approach, integrated care teams, and providing healthcare quality with excellent utilization and low costs among chronically ill patients. So this is actually really important to us because we see this as a foundation to where we are all moving towards value-based care. We're hopeful that more of our health centers will become PCMH designated over the next 2-3 years. Excuse me. And as you can see, we have a large number of clinicians, physicians, nurse practitioners, PAs, dentists, of course, oral hygienists, and mental health providers. As you can see, also, I wanted to showcase one of our programs, the trauma-informed care training. We're at 40% training of our health centers. So I'm very excited about that, and I'll talk to you a little bit more about that because that is part of the workforce development that we see. TAC provides training and technical assistance programs prioritizing the education and confidence building of health center staff. So some of these examples of unique training programs include the trauma-informed care program. Others that I would like to mention are the quality access program, which again, it strengthens the health center staff on improving the quality outcomes in their health centers, focusing largely on health equity. So as an example that I wanted to bring forward that has been shown to really engage staff and support staff is the trauma-informed care transformation program. And it's been shown through other outside studies and research that when a health center is trauma-informed, the staff feels empowered, supported, and included at their place of employment, leading to the following outcomes: improved staff satisfaction, reduced re-traumatization for the what they may be witnessing as secondary traumatic stress, reduced secondary trauma, as I mentioned, and reduced staff turnover, ultimately improving health outcomes. TAC is actually involved in this transformation of our health centers and tracking the data that is aligned with the improvements of health outcomes and reduced staff turnover for this particular program. Next slide. So at its core, the TAC programs are typically organization-wide and lead to quality improvement and transformation and aligned to advance the most pressing and pertinent health initiatives of our time. So I have this slide here because this really keeps us focused on what we're here to do. We're here to improve health equity. We have we value integrated services, and we try to support that in every way possible, particularly thinking through about how medical, dental, and behavioral health can interact and support each other in a whole person care manner. So patient-centered, of course. The workforce development is part of what we do, as I mentioned. And then I want to also talk a little bit about the social determinants of health, or sometimes called social drivers of health, and trauma-informed care, and how those are related. The prevention and mitigation of structural, institutionalized, and social drivers of poor health can be achieved through the adoption and implementation of what we call universal trauma precautions through trauma-informed care. So that's approaching every patient as if they may have been exposed to some degree of trauma, either personally, historically, community-wide, and also recognizing that the staff is part of the community. As I mentioned, 51% of the board members in every single health center are part of the community and are patients at our health centers. So thinking through this, that patient and community access to and the utilization of resources can be improved when there is staff engagement that is grounded in pillars of trauma-informed care, such as safety, trust, choice, collaboration, empowerment, peer support, cultural, historical, and gender factors. Therefore, the alignment of social determinants of health and trauma-informed care are completely intertwined, and it cannot be separated one from the other. Going through other programs that I also want to mention and showcase here briefly are the disaster preparedness, response, and recovery. Of course, we supported all of our health centers and continue to do so through the COVID pandemic endemic, and now even with the monkeypox as an emerging infection. So all of these, just know that this is the background to where when a patient goes to a health center, this is the support that they have, that the health center staff has to support the patient care. And the Quality Access Program is our newest initiative, which actually launches at the end of this month. Although it is I'm going to say an overhaul of the previous quality program because we've really updated it. And that is to provide support to the health center so that they can do quality improvement on a routine basis and demonstrate improved outcomes in order to prepare for value-based care, which is, again, where I think many of our organizations are trying to shift and move and train towards. Next slide, please. Thank you. Great. So if you want to find a health center, there's a very easy tool, find a healthcenter.hrsa.gov. And if you would like to learn more about TAC, our association, there's also a website right there, a link. I just wanted to share out that all of the partners here represented on the panel are truly partners, and we all support each other towards improved primary health care, which of course it has the oral health component in it, which is critical to improved outcomes. You cannot do one without the other. So I think I'll conclude at this point and then pass it on to the next panelist, and we'll receive questions at the end of the presentations. Thanks very much.
Thank you guys so much, and thank you guys for having me. My name is Erica Castillo. I'm with the St. David's Foundation Dental Program, and I'm here to talk to you guys a little bit about what we do, how we work, and so forth. And so I'll go ahead and start off, and please go to the next page. So our dental program at a glance, we are one of the largest charity-based programs in the country. We offer free dentistry to students within Central Texas. We do work we're currently within 6 school districts and 4 charter schools, and we'll dig a little bit deeper into our locations and areas here in a little bit. And then we have clinicians, we have up to 50 dental staff. We do work with several teams. We have clinicians that are broken into 4 different teams, as well as some operations staff that works back at the office to help organize and get everything ready that we need so that we can make sure to get everything ready for the clinicians when we get there. And then we also, let me move my little box, hang on just a second. And then we also work, see up to 3,300 students treated annually. This number is a little bit lower this year, only due to COVID. Again, we've had to deal with while at schools, we had to deal with just, COVID and the minimizing the students and not being able to treat as many as we can. So we'll kind of dig a little bit deeper as far as the numbers go from years previous to COVID to where we currently stand right now. Next slide. So what we provide free dental care to students within Title I elementary schools within Central Texas. There is never any cost to the parents. We don't bill insurance. It is all completely free. The dental treatment that we provide, it's at elementary school level. We do go to the Title I schools. We treat the students from kindergarten to 5th grade, and we provide them with x-rays, the whole dental exams. We provide cleanings, sealants, restorative treatment. As far as a restorative treatment, we provide them with composite fillings and extractions, and we are limited on some of the treatments. So we do also work with a lot of our external partners. We have a complex care services as well, and that's when we end up kind of having the community dentists help us out a lot with just the partners that we see. So with the students that we're unable to treat on the vans, that goes a lot of the treatment that it's some sedation cases, some stainless steel crowns, some lab work. We are a little bit, since we're, I'm so sorry, since we're a little bit, we limited on the treatment that we can provide on the vans. We end up depending on some of our providers in the community to help us with that. So we do go to some pediatric and endodontist, as well as some oral surgeons, some endo, and some general providers. We do have up to 12 community partners that we work with right now. And those are the dentists that help treat the patients that we're unable to see in the complex care program. And it's all continues to be free for the parents. The parents still do not have to pick up the cost of that treatment. The foundation ends up paying for half the cost, while the dentists that are working on them do the other half pro bono. Next slide. The geographic area that we see, we are within Central Texas, so we do go far north as Round Rock and Pflugerville school districts. We are broken up into 4 different teams, so you'll see the different colors. So we have up in north, we have our purple team, which they'll do Round Rock, Pflugerville, some northern schools. And then we come down quite a bit, and we have our red team, who they also kind of work within some of the Round Rock, Pflugerville, depending on the locations. And then they're further into North Austin and some Manor schools. we come down a bit more and we're into the blue team, where they're more within Central Texas. They're basically more into the IS Austin Independent School District, as well as some Manor and some of the charter schools. They are the blue team. That team, as we've noticed, a lot of the population within the Austin ISD is moving out. So they tend to have the most schools that they're seeing right now, only because they go through their schools so much faster. So with that being said, we have to add as more schools as we can on their schedules. So the blue team does have a pretty more robust schedule because of that. And then we go further down a little bit and we have the orange team, which the orange team they see a lot of the patients out in Hayes, Del Valley, and some Manor, as well as some charter schools. But a lot of those outlying school districts, what we're seeing is there's just such higher demand for care out there that our dental vans, when we're out there providing the care, we just have been out there for sometimes up to 4 to 6 weeks at one school campus, only because of the amount of decay that's out there. It's just increased greatly at the outskirts of Austin. Next slide. So we do have a school universe right now of 109 Title I schools, and that's including the ISDs as well as charter schools. The lowest student economically disadvantaged number of the percentage that we go to at the schools is 31%. We do have a cap at about 45, but we do see these we do have a few of the elementary schools where the principals have contacted us and have been inquired about having us at their campuses, and it's really hard, especially when we get a principal who's advocating for their schools. It's we really don't get those calls, but when we do, we really try to meet that demand. So we do go to a few of couple of those schools, which we also take into consideration the consent form rate and previous decay levels there. So just kind of putting those in together, we do see a couple of them that are below our threshold. And then the current socially economically disadvantaged, the highest one that we have is at 99%. Next slide. So our year-over-year data, what we have seen, we wanted to let you guys to capture a picture of what it was before COVID to what it was during COVID. So there are the huge differences there. They're all basically around 50% difference, but in the total schools that we were able to go to, 2018, 2019, that was our last year before COVID, were 63 campuses. Compared to this past and 21-22 school year, we went to 35. There is that 44% difference there. In the next column, you'll see the children screened. We have not been able to provide screenings at the campuses, only because of limited entry and just as far as the fluctuation of the COVID rate and stuff. So what we've been doing is we've been just passing out general blanket consent forms to the campuses and just treating whoever it is that returns them. So in the past, we were able to treat 23,535 through screenings to where we have not been able to screen. We are hoping within this upcoming school year, we're still hoping and we're preparing to begin those screenings again starting in August. So hopefully we can have some better stats around that. The total patients treated, we went from 9,811 to 4,286. Again, with the limited schools, but also with the regulations that were put into place around COVID, the extra cleaning, the not having multiple patients on a time, it really limited us on how many students we're able to see. But also putting those stipulations also we were able to get into the campuses a lot easier too. So we've been working with these AISDs, with the ISD school districts for so long that they trusted us and they allowed us to come in, even at times when they weren't allowing a lot of other organizations to come in and treat at the schools. So we're grateful with the numbers that we did get. The total dental visits, 17,000 to the 8,000. And we're looking at the total dental visits to total patients. We're looking at how many times they came to the vans. So again, each child comes multiple times for the exam, their cleanings, and depending on how many fillings they need in their mouth. So we'll kind of prioritize those, work with them, and the clinical team calls them accordingly. As far as the value of treatment provided, you'll see about a 54% difference there from the 8,700,000 that was provided in 2018, 2019, so just a little over $4 million. Now, what we find a little bit interesting is the average value per patient. So in the 2018, 2019, the 890 was the average value. To what we're looking at currently, we are providing them with more treatment. So each patient is receiving about $940 of value per care. what we're looking at and what a lot of the clinicians are reporting back is there's just the increase in restorative care, and especially after being out for 2 years, being within COVID, dental has kind of been put in the back burner for a lot of families. So as we're going into these school districts, we're noticing higher levels of decay, higher levels of plaque, and the buildup and stuff. So that a lot of that is taking into consideration how many students are getting seen and how much care is being provided to these patients. Next slide. So in the summer, when we're not able to see any students and we're off of the schools, we do provide care to adult patients. And you're going to see the difference in the numbers here. In 2018, we were able to go provide to see up to 439 patients, which equaled out to the 402 visits. The difference, and you'll see the decline as we've gone throughout the years, it's not, some of that is due to COVID and the stricter guidelines as in 2019 to 2021, but it was also in 2018, we were going to a couple of adult agencies that turned into FQHCs, which is great because now they have a dental home. So that's what we want to see. So 2 of the agencies that we used to go to, we're no longer able to partner with them. So right now we are just partnering with Volunteer Community Clinic, which is our last adult agency that we're currently at right now. We are looking at 109 patients. That was as of last year, and we are continuing to treat them this summer as well. Next slide. Within our complex care program, this is the program that we work with the communities in the community, where our providers in the community. We had up to 277 patients go through the complex care program in 2021. Out of those 277 patients, there was 932 appointments made, again, because of multiple appointments for treatment and such. Our no-show rate was extremely low. There was a 3% no-show rate. We do provide them with taxis if they don't have transportation. We work with them to get the families to get there to their appointments. We want to make sure that they show up, that they're on time. They're in constant communication with our complex care program organizer, our coordinator, and she does a great job at getting them situated, getting them to the right location. She meets them out there at their appointments. If they're a lot of our families that we do see are bilingual, and some of the providers that we go to do not have any Spanish speakers in the office. So our coordinator would go out there and she would go and kind of work with the families, work with them all out there just to make sure that they understand the process, understand what's going on, and to try and also provide them with some great oral health education as well. Lets them know, not just for the parent and for the patient, but for the family, especially kind of observing the family. If they've got little ones, if they have babies, kind of talks about anything from nutrition to oral health. So that our no-show rates are really, really low, and that's a great thing. We also, the value that was provided in 2021 was the 1.2 million of care to the 277 patients, where the foundation ended up paying 710,000 of that, and the rest of that again was done pro bono by the providers. As you can tell, most of the students that we did refer were pediatric patients or pedo care, so they went to the pedodontist. A lot of them were sedation, a lot of stainless steel crowns, just a lot of just that care. And we are looking at the pediatric, there was a huge increase in that. And a lot of that we're thinking also is we were not able to screen. So because we were not able to screen, of course, it's the little kids. It's when we're typically sending home stuff in the backpacks for students. It's the parents of the little ones who are looking in those backpacks a little more often than the older kids. So we did get a huge influx of consent forms from kindergarten, first and second graders. So a lot of those, so we had more of those than we do third through fifth, which typically we would have more third through fifth because they're the ones who have more permanent decay. So we kind of saw that difference, and we saw it in the complex care program as well. We did send 15 patients to the oral surgeon, 14 to endo, and then 1 to general. When we're looking at oral surgeon, or endo even, for the endodontist, of course, some of it is treatment is a little bit extended. Either they're open apices, they're not able to complete the root canal at this time. So they do consistent to multiple appointments, which are extending the time that the provider is providing with that patient. So they are limited on how many patients that they take. And so that kind of takes into consideration the amount that we can provide them. But this is just a great example of how we've extended the care into the community. Next page. And then we also have our oral health education program. So our oral health education, we have an oral health education manager who works with the Head Start programs. The Head Start programs are focused out of Austin Independent School District, and she provides them with oral health care, the toothbrushes and toothpaste, baggies, instructional videos. During COVID, they went virtual, of course, like all the other schools, and they were a little bit slower to come back. So a lot of the work that we provided with them was online services. And so as we know, a lot of the families that we work with, it was a little bit more difficult to have that contact. So we're hoping within this next upcoming school year, they're gonna be coming back. It's gonna be in person again. And we're hoping to start that communication again. It's just a great opportunity to be able to get to the parents on a parent level, because they do have to attend these classes as well for their students to be part of the Head Start program. And so this just gives them it's a great opportunity just to learn more about nutrition, about health, about cooking. And our oral health educator is great at just getting those tutorials out there for them. Another way that we're able to work into the community is through health fairs. Those, again, we're kind of put on the back burner because of COVID, but we have been getting a lot of requests for health fairs as school's starting up. Back to school fairs are coming on again. So we're going into a lot more back to school fairs. This is, again, another opportunity to get in front of the parent. This is a way for our staff to interact with parents, teach them a little bit more about oral health and about who we are and what we provide. And then parent classes. We're hoping to start up parent classes a little bit more this upcoming school year. Again, parents, having that parent interaction is really important. And it's not just educating themselves or their child, but also educating the family as well. So we find these are just 3 ways that we're able to currently to be able to use our oral health educator. Next slide. And then this past year, we started working a lot with equity, diversity, and inclusion, EDI. We began working with a group called Common Health Action, and we began with assessments that consisted of surveys, in-depth interviews with our staff within the St. David's Foundation, as well as some internal and external focus groups. The work that we're completing is to help us develop a plan to institutionalize equity into the St. David's Foundation policies, our programs, and our practices. So what we're currently doing in the beginning of the year, a lot of our leadership team were the first ones to go ahead and take these. After the questions and surveys were completed, Community Health Action put together a kind of a work plan for us, and our leadership team were the first ones to go ahead and go through the process. It takes about 7 to 12 hours depending, and it's just a lot of questionnaires and a lot of learning and stuff, digging a little bit deeper into EDI. After the courses are completed, they were continuing those conversations with Community Health Action. I want to say they were the first ones to do it in the beginning of the year. In the summer, it got extended out to the rest of the foundation. So we have all blocked time off we have 3-4 hour blocks at different days to go ahead and get this taken care of as well, to kind of go through the courses as well. And then in the fall, we'll be scheduling some time as well, also to go ahead and go through some more in-depth interviews with Common Health Action. And again, this is all just to strengthen the foundation and what we can provide to the community. Next slide. Thank you so much. And I'm going to go ahead and turn it over to Beth for our next speaker.
Okay, and as Dr. Vargas is coming on, I do want to send a quick reminder to everyone. If you have any questions after each presenter, please enter them in the Q&A box for that presenter, and that way Dr. Dhar can find those easily. Thank you. All right, Dr. Vargas.
Okay, good morning, everyone. Again, I'm Dr. Michelle Vargas. I'm with Methodist Healthcare Ministries. Excuse me, I'm so happy to be here with all of you. Thank you for joining us. I'm happy to share with you what we do at Methodist Healthcare Ministries. We're based here in San Antonio, Texas. I'm a native of the San Antonio area, so it's especially meaningful for me to be part of our organization that's making such a difference in the lives of those in our community here and the counties that we serve. Let's go ahead and get started, and let me tell you a little bit more about what we do. Methodist Healthcare Ministries is a private, faith-based, not-for-profit organization, and we're dedicated to creating access to healthcare for low-income, uninsured patients, and we do that through direct services, community partnerships, and strategic grant making in 74 counties across South Texas. And I may refer to Methodist Healthcare Ministries as MHM throughout my presentation. Next slide, please. Methodist Healthcare Ministries was founded back in 1995 after the Southwest Texas Methodist Hospital partnered with HCA Healthcare to establish the Methodist healthcare system, which is one of the largest healthcare providers in the San Antonio area and 24 surrounding counties. And as you can see here, we've got 9 San Antonio hospitals, 5 surgery centers, and 27 facilities in the system. The Methodist Healthcare Ministries owns 1/2 of the Methodist healthcare system and maintains local governance. And this is important because it ensures that the needs of the greater community are served and met here in our community. Our partnership with HCA is very important. It's an important part of our mission. And the Methodist healthcare system continues to be a great benefit to our community by providing quality health care to all, and also charitable care when needed. And the revenue from the system is what helps provide the Methodist Healthcare Ministries the monies for our programs and our services. Next slide, please. This is a map of the service area. It is based on the Rio, Texas conference of the United Methodist Church with 250 funded sites, which include, as you can see, we've got 90 funded partners, 80 Wesley nurse sites, 54 parenting program sites, 13 community counselors. We have 6 community health workers, 4 primary care clinics, and those are in the San Antonio area, and 4 Get Fit sites. And I'll talk to you a little bit more about some of those as we go on. Next slide, please. Methodist Healthcare Ministries is much more than just clinical services. Our key objective is to build partnerships through collaboration and to facilitate access to healthcare. And we do this through community investments and grant making. The picture here that you can see is a donation to a housing community for homeless seniors in the area. They just began construction with that, I believe, in April. We also do that through direct provision of healthcare services, and that would be through our primary care clinics and our regional wellness programs, and as well as through community partnerships and advocacy. Next slide, please. When you're thinking about the definition of healthcare and defining it, so oftentimes we are just focusing on the clinical care piece. But like many other organizations, we realize that what defines and contributes to health and wellness is much more than a clinical care. And factors like community safety, housing, education, and health behaviors and many other social determinants of healthcare play a much larger role. So the board and our CEO realized that by broadening its focus, it can include these factors and it could support and increase the effectiveness of the existing programs that we have while still making a difference in the communities that we serve. Next slide, please. This is a patient-centered care model that we use at our clinics. It's integrated, as you can see. In the middle, you have the patient and the care coordinator. And our care coordinator helps direct our patients to the services that we provide, which of course include the medical team, psychiatrists, the dental team, our amazing Wesley nurse program, social work, and counselors. The outer ring, as you can see, are other services like health education, spirituality. I think that we're very unique in that factor because we do have 3 full-time pastors on staff. to be honest with you, a lot of times when patients come in and they're first being registered, I find that, of course, they're not going to accept all the services. They may get registered and just say, no, I just want to see the medical doctor, or I just want to see the dental team. And that's okay. But what we find is as we start building relationships with our patients and they start to begin to trust us, they're willing to accept some of the other services that really will affect their overall health and well-being. We have a well-structured interdepartment referral system, and that enables us to provide those incredible services for the patient. And also when needed, we do warm handoffs to other departments for immediate needs such as food, transportation, utility assistance, rent assistance, or if they need immediate counseling. Next slide, please. Here's a look at our clinical facilities that we have in our local area. We have 4 primary care clinics. Our main 2 clinics are our Wesley Health and Wellness Center, located here in San Antonio on the south side, and our Dixon Health and Wellness Center on the southeast side of town. We also have 2 school-based clinics, the George Rick School-based Clinic in Schertz at Schertz Elementary. And we also have the George Rick School-based Clinic in Marion, Texas at Kruger Elementary. And I'll talk to you a little bit more about those in a few minutes. Okay, next slide, please. Here's a team that I work with. We have a talented group of 11 general dentists who have an average of 20 years of experience. We have our board-certified oral surgeon and 13 hygienists. Having a full-time oral surgeon on our staff, as you can imagine, puts us in a really unique situation. We're very excited and happy to have her. She's been with us for over 5 years now. It puts us in a unique situation in that we don't have to refer out oral surgery services to an outside oral surgeon. We have great communication with her. We can see her notes in EDR. We can task her or Teams her if we have any questions or concerns with any of the cases that we collaborate with. The other thing I wanted to point out on this slide was Dr. Webster. He's our general dentist. He does provide pediatric services at our school-based clinics. We're blessed to have him on our team. Next slide, please. As you can see here, we have a comprehensive list of services that we provide for our patients. We like to think that we offer some of the most highly comprehensive dental services for the uninsured in Southwest Texas. It's really basically what you'd expect to get at a private dental office and more. Our treatment begins with a comprehensive oral exam and medical history. We use all digital imaging, which includes CBCT scans when needed. We have CBCT scanners in our Wesley Clinic and our Dixon Clinic. We have a great team of hygienists that provide periodontal treatment. We do a full range of general dentistry, including crowns, bridges, implant-supported crowns, partials, dentures, a full range of treatment. Our patients are, once they're accepted and registered as patients, it's not free. We do have a sliding scale, but they are able to get all the treatment that we recommend and that they accept regardless of payment. So I think that is why we have such a comprehensive amount of services that we provide. Our patients do accept treatment, and so we feel like they're getting the very best treatment that we can possibly provide. Our oral surgeon does what you could imagine. She does biopsies, bone grafts. She does place implants with surgical guides. She does IV sedations, and she does provide hospital care for medically compromised patients at our Methodist main hospital at the medical center. Next slide, please. Here's our Wesley Health and Wellness Center. At this clinic, we have 24 dental chairs, with 22 of which we use for general dentistry and hygiene. 2 of those are for oral surgery suites. We have a staff of 5 full-time dentists and 6 hygienists, as well as 1 LVN here. We also have our ceramic lab and our removable lab here at this location. Next slide, please. Here's our Dixon Health and Wellness Center. Just like Wesley Clinic, we have a total of 24 dental chairs here, with 22 of the dental chairs used for operatories for general dentistry and hygiene. And we also have 2 full oral surgery suites. Just like at Wesley, we have 5 full-time general dentists, 6 hygienists, and 1 full-time LVN here. And we also have a removable lab at this location. Next slide, please. Here's one of our oral surgery suites at our Dixon Clinic. This is where our oral surgeon works out primarily. As I mentioned earlier, in addition to working at this clinic, she also treats medically compromised patients at the Methodist Health Hospital at the Southwest Texas Medical Center. And in addition to the work that she does there at the hospital, she also treats patients at one of the school-based clinics about once a month. Next slide, please. With Methodist Healthcare Ministries, one of the things we're most proud of at our dental centers is that we have our own in-house dental labs. We have those at Wesley and at Dixon. We have 9 dental techs that operate a full ceramic dental lab and a removable appliance lab. As you can see here, this is one of our lab techs, Karen. She does amazing work for us. We're really blessed to have her on our team. Our ceramic lab uses the highest quality materials. We have state-of-the-art equipment, including CAD/CAM technology. We have our very own in-house milling units. We've been doing that for years now, where we fabricate lithium disilicate and Brexer crowns. And we do crowns and bridges. Next slide. This is a picture of one of our removable lab techs. We have a talented team of removable lab techs. They have really decades of experience in fabricating complete dentures and partial dentures. They make Essex retainers and flippers. They make hard and soft night guards, and they also make sports guards for the kids at our school-based clinics. Next slide, please. Speaking of school-based clinics, our school-based health center based in Kruger Elementary in Marion and at Schertz Elementary in Schertz, they run in centers that use our integrated care model, just like our main clinics do. We recently celebrated 15 years of service to the school districts, and the team there serves children in the school district and their siblings up to the age of 21. Our agreement with the parents and the schools allows us to take the children out of the classrooms for treatment. So as you can imagine, that's a great service to the community there. Oftentimes the parents still come in for treatment. And they're there with the students, and there to support them. And of course, we welcome that. The medical team there conducts sports physicals, wellness visits. They administer vaccines. Sometimes they do nebulizer treatments, acute pediatric care. The behavioral health team provides case management and counseling at the school and at the health center. And we're here, of course, to talk about oral health services. So, of course, our dental programs include preventive and restorative treatment with annual screenings, fluoride varnishes, dental sealants, extractions, what you would expect in general dentistry. A lot of sports guards and oral health education. And like I said earlier, our oral surgeon does go out to one of the school-based clinics about once a month to do treatment there as well. Okay, next slide. As I mentioned earlier, our policy and advocacy team does advocate for good public policy by keeping on our radar important legislation that affects health and wellness. One important example of the legislation would be the newly passed teledentistry bill that we probably all heard of. It was passed in late May. This was really important because it opens a door for dentists in Texas to provide dental health remotely, especially in those areas or counties where we don't have an adequate number of dentists to provide services in those communities. Another important bill that recently was passed by the Texas State House was Bill 2658. This is the Medicaid coverage bill, and this was a huge added benefit for families that never had this service before. For those of you that aren't familiar with that, it provides one annual preventive dental service, and that's for disabled adults enrolled in the STAR Plus Medicaid program. This was a very huge win for the families, and these are services that they weren't able to get before. So again, we're very proud of our team to be able to advocate for good policy and just keep our whole organization abreast of legislation. Next slide, please. I mentioned earlier about partnerships. Another important way that we help provide access to oral health care in Bexar County and other counties that we serve is through our funded partners. Our community funded partners, as some of them are listed here, receive grants for dental service and for health professional shortage programs. Funding for our 8 dental service programs total $2,960,000, and that's for general dentistry service programs in these counties. And we also fund 6 health professional shortage programs, and that totals $710,000. And the professional shortage programs, that's primarily for dental salary supplements and also used for residency training programs. So the combined total for all 14 of our partner programs is over $3.6 million. We're proud to partner with these amazing organizations in various counties, as you can see here. Next slide, please. Coming back locally, in our dental clinics in 2021, we had over 25,000 patient encounters, with about 3,400 of those encounters being unique individuals. In that time, we delivered over 1,100 crowns and bridges and 800 partials and dentures. And those were made right here in our in-house ceramic and removable dental labs. As you can see here on the right, our patients at our clinics based in the San Antonio area come, of course, primarily from Bexar County, but really 21 other counties, as you can see here: Guadalupe, Atascosa, Medina. So in addition to serving in Bexar County, we do serve patients from many other counties. Next slide, please. Additional MHM services. So in addition to our primary care, there are a lot of other services that we provide that go beyond and help increase the wellness of our patients. One of them that is going on right now downstairs is our Wesley Camp program. That's a 4-week summer camp program. So we have about 100 happy campers downstairs right now. I think they've already ate breakfast and moving on to their next activity. We also have an after-school program here at the Wesley Center, and that runs all year long. Next slide, please. A great program that serves the rural underserved communities is our Get Fit program. It's a preventive program aimed at promoting active, healthier lifestyles for school-age children and their families. It helps to integrate physical fitness, good nutrition, and also emotional well-being. And this program is offered through the school year, and they also have a 1-month summer camp as well. And enrollment for that is free. Next slide, please. Our community health workers, sometimes they're referred to as promotores de salud. They increase wellness by connecting and engaging with underserved families and communities to help improve the health outcomes in their communities. This is a great program in that they build relationships with the residents there in their communities. They help connect patients and clients to health care and services that they may not have been aware of. And they help navigate health and social barriers. They really promote partnerships in the neighborhoods that they live. And one example of that is a great community partnership that they have in the neighborhood at the Dixon Clinic. Next slide, please. We have enrichment programs, and these are a fun way for our clients to be creative and to, it really improves the quality of their life because they become very socially engaged. Anyone can participate in the programs, and they're free of charge. Meals are free, they're provided during the classes. And some of the activities include crocheting, sewing, Rosetta Stone, and jewelry making. This is a fun group to see. I see them all the time. They come with their supplies and they're excited to be participating in it. And they've bonded and made a lot of great friendships. So it's fun to see right here at our clinic. Next slide, please. We have some really great recreation programs. The classes, those are completely free. Equipment is provided free of charge. They usually run Monday through Friday. They have stretching and meditation, the Get Fit cardio program, our daily burn, and the Baila to Fitness. I was downstairs yesterday or the day before at lunch, and I could hear the music pumping, and just like that lower right picture shows, really is a full gym of our clients having fun and being active and making friends. Next slide, please. Our recreation and enrichment programs have special events every year, as you can see. One highlight is our spring and fall walkathon, where our clients are encouraged to walk 3 to 5 miles on an outdoor track, and we provide prizes and refreshments. We have our Pink Out Cancer Bailathon, and that's held during Breast Cancer Awareness Month. We have our National Night Out, where we host a fun community block party and provide information on different community services, and we provide food and refreshments, and that's a lot of fun. And as you can see here, we have tons of special events like our Harvest Fest, our Thanksgiving Lunch, Adopt a Family, our Elf Louise project, and our Christmas Tree project. Next slide, please. We also have parenting programs, and these are a really important part of our organization because it helps our parents that come from families that are high needs families, first-time parents, really gives them the practical support they need to help learn parenting skills. These are a 2-year program. It's a full curriculum. It's for parents with children that are from prenatal to kindergarten age. They have 2 home visits and 1 group connection meeting each month. We have parents helping parents support groups, and we offer referrals if we see that there are delays or health issues. Next slide, please. Each year, our parenting program hosts a number of fun projects. We have our annual field trip for the families where they get to visit a local attraction. It might be like SeaWorld or Fiesta, Texas. It's a fun day for the whole family to join and have a great time together. We have a graduation event where we give a small gift for each graduate. We have an annual family wellness seminar, and one important element I want to note in the parenting program project is that we have a depression screening and intimate partner violence screenings. And that's an important element because if needed, we can refer those for services. Next slide, please. I'm going to close with you today with a quote from John Wesley. And this is a quote that we live by at Methodist Healthcare Ministries. If you have any questions, please feel free to leave them in the chat box. Thank you so much for your attention. And I'll pass it on to the next presenter.
I guess it would help if I unmute myself. Thank you. I'm Nancy Blinn. I'm the Executive Director of Dental Health Arlington. I am so privileged to be in such an esteemed group today. Wow, what amazing things that are going on around the state. I'm sort of a little version of what all of these people are accomplishing, and it's just amazing. And it just makes my head want to blow up for all the things that I want to do, just like you guys do. It's just amazing. So Dental Health Arlington, or DHA as we call it sometimes, its mission is to provide preventive and pain relieving care. Oh, sorry, y'all. I didn't have my camera on.
Much better. Thank you, Nancy.
Thanks, Beth. Sorry about that, guys. DHA's mission is to provide preventive and pain relieving dental care to the underserved residents in Tarrant County and to educate children about proper oral hygiene habits, nutrition, and the importance of regular dental care. Our core values are basically our patients' needs come first. So we serve our patients through our core values of compassion, collaboration, integrity, and excellence. We're committed to take time to listen, understand, and be empathetic. We are committed to empower our patients and staff through teamwork. We're committed to be truthful, respectful, and transparent. And we are committed to constant innovation to better serve our patients. Next slide, please. So Dental Health Arlington started out as a United Way needs assessment back in 1991. They were looking for low cost or no cost dental in Southeast Tarrant County. Finding none, several community members came together with dental professionals, and donated space was given to us from Dr. Alan Sachs, who was a former professor at the University of Texas at Arlington, and a clinic was born. Originally, it was an all volunteer staff. It was made up of different, hygienists, dentists, assistants. They would just come in a few hours each week. But what they started noticing is there was a real trend in the children that were coming into the clinics, and they saw rampant tooth decay. So in the next year, 1993, they decided to go and start a pilot project in two of the poorest schools in Arlington, because they were trying to get together to figure out how can we reach these kids at a much younger age, and what can we do to get prevention out there. So they decided to start this pilot project, and I'm going to let you go to the next slide, please. And I'm going to talk a little bit more about the school-based program in just a second. So we started out in that very small one-room clinic, and we have now expanded. We actually separated from Mission Arlington. Mission Arlington still has a free clinic here in Arlington. But with the school-based program, Dental Health Arlington went in a separate direction and really wanted to focus on the school-based clinics. However, once they separated from Mission Arlington, they realized they still needed a dental clinic. So fast forward 30 years, we're actually celebrating 30 years this year, and we actually have our own clinic as well as the school-based program. So this is just a couple of pictures from our dental clinic that's located in downtown Arlington. Last year, we saw 3,224 patients. We provide all types of dental treatment. So we try to provide a nice, dignified experience for the low-income residents in the area. We provide care for low-income, uninsured, undocumented. So we're basically a safety net solution for people who have no access to care. We provide care throughout Tarrant County. They don't have to just be an Arlington resident. We started out, it was just Arlington, Mansfield, and Kennedale, but now we've expanded to all of Tarrant County. We have kind of a unique program. We do kind of a layaway program for our patients. So our patients pay a $25 reservation fee when they first come to our clinic, and that's to reserve their spot. What we found is this really helped reduce the no-show rate. So we do a layaway program. So if they have to have some work done, they basically come by each week when they have a paycheck, and they come and they deposit in their account. And then when they're ready to have their crown or root canal or filling or whatever it might be, it's already prepaid. So they can just come in and just know that it's all taken care of. And then we just kind of help them move forward through their patient care journey. We are one of the only clinics in the area that provides emergency exams every day, and same day treatment. This is getting a little more challenging through COVID because we used to have 1 to 3 walk-in patients, emergency patients a day. Some days now we're up to 10, 11, and 12 walk-in emergency patients, in addition to our regularly scheduled day. So it can get a little crazy at times. Our patients must provide proof of residency in Tarrant County. They provide pay stubs and then a photo ID. That's what they need to be eligible. And then they self-certify. We have partnerships that we work with Arlington, the city of Arlington, and the HUD department. And they have to self-certify as well where their income level is. We've done over $1 million in donated services, and that's just over the last few years. That's probably a much larger number. It hasn't always been tracked all the way back. So we are, during COVID, we were one of the only community-based dental clinics to remain open during the initial shutdown. We were very proud of the fact that we kept over 150 to 200 patients out of the emergency room because that was going to be their only option. So we were extremely concerned. We did have to lay off a lot of the staff. I donned my clinical wares once again, and I helped assist, and we kept a very skeleton crew here, but we were able to manage to keep people out of the emergency room, which was a big deal. Next slide, please. So this is our school-based sealant program. So now we've grown from those 2 pilot projects, we have grown into over 43 Title I schools in Arlington. Our school-based program is only in Arlington right now. We do oral hygiene education. We introduce the 1st, 2nd, and 3rd grade children, and in the classrooms, we actually go out and teach them in person. We are back in person again after being out also for COVID. We have a dentist on staff that provides screenings for the 2nd and 3rd graders for the children that have had permission slips returned. I'm sure some of the other presenters can appreciate this. The permission slip rate has dropped considerably this year, and we're not really sure why, because we don't know if it's because a lot of the parents didn't know about our program since we weren't in the school because of COVID. But we're trying to really work on that. So if they have a permission slip, they can be screened. I write grants and donations, basically provide everything, including the portable equipment and how to pay for my staff, that sort of thing. It's strictly a free program also to all the students. We see almost 9,000 students a year in the schools. Part of that is the education piece because we educate all the 1st graders in all the Title I schools. However, we do services for the 2nd and 3rd graders. So we provide sealants, fluoride, and the screenings, as well as the education for 2nd and 3rd graders. And this year, we actually just received some funding from Women Inspiring Philanthropy here in Arlington, and we're actually going to expand into our 4th grade. Our long-term strategic plan, we'd like to be all the way up into the 6th grade and then possibly provide education beyond that. The original, all volunteer program became, we have all hired staff now. We have a dentist and a hygienist. We've kind of scaled back because we have a really unique position. We partner with the University of Texas in Arlington. We have a lot of pre-dental students that come and they help in this particular program. We also work with the Career and Tech Center, which is here in Arlington. It's high school students. And they come and they do rotations through. So we have a lot of volunteers now that help us. So we've scaled back some of the staff, which helps in costs, and then also be able to partner with these agencies, and they get a little taste of what dentistry is like and managing the children, and they get to learn to suction and be providers. So it's an amazing collaboration. We named the program the SMILES program, which stands for Sealing Molars Improves the Lives of Every Student. And again, staff was hired as we expanded, and we're currently in the 43 Title I schools. Those are growing every year, and we're probably going to be moving up into maybe 45 or 46 in this next year. During COVID, we had to figure out what we were going to do because I couldn't get my staff out in the schools, but we were very worried about the kids. So what we did is we pivoted. I have staff here in the clinic 4 days a week, Monday through Thursday, but our Fridays are open. So we decided to bring the SMILES team here and then sent the permission slips home to the parents and did a digital online ask to the parents to let them know that we were going to be open and available for these free services every Friday. We wound up seeing about 800 patients that year, but we wound up doing more services because they were in the clinic environment. We were able to do x-rays, we were able to do some fillings, we did cleanings. So we got to do more services. So we wound up doing about $177,000 in donated services, which was about $200 average per student. So we were able to, we didn't see as many students, but we were able to do more procedures. And then the nice thing was the parents brought them here, which the whole point of the school-based program is the parents don't have to do that. It helps keep them, out of that piece so they don't have to miss work. However, the upside was we also see adults in our clinic. And so these parents, a lot of them didn't have any access to care and didn't know we existed. So it really was kind of a twofold. There was some good that came out of the COVID, believe it or not. So next slide, please. This is just a little video. I'm going to let you guys just watch this for a second.
Hi, I'm Nancy Mannion Blinn. I'm the Executive Director of Dental Health Arlington. Did you know somewhere in Arlington that a child is not sleeping due to dental pain? Is that something your child has experienced? Dental Health Arlington is here to help. We are Dental Health Arlington's SMILES team. SMILES stands for Sealing Molars Improves the Lives of Every Student. What are sealants? They are a protective coating painted in the grooves of the back teeth to avoid cavities. In fact, kids without sealants have 3 times more cavities. The SMILES team has licensed dental professionals that come into the local elementary schools and provide dental education, dental screenings, fluoride treatments, and sealant placement during school hours, all for free. There are so many advantages to our team coming to your school. Parents don't have to take off work. Students miss very little school instruction and are not considered absent. It provides them a safe, comfortable, positive first dental experience with their friends. Our vision? Giving every child a healthy smile. How can your child participate? Be on the lookout for the permission slips from your school or go to dentalhealtharlington.org.
Thank you. Next slide.
Hi, I'm Nancy Mannion Blinn.
Oops. Thank you. Dental Health Arlington is a typical 501c3 organization. So we're governed by a board of directors. We have 11 members, and then myself as the executive director. We have a financial administrator, a clinical director, the SMILES sealant director, and then again, 3 clinical dentists, 1 SMILES dentist, 4 clinical assistants, and 1 SMILES assistant, 1 clinical hygienist, and 1 SMILES hygienist. Next slide, please. We're kind of a unique design, and we're different from the for-profits in that we're a safety net solution and we're a teaching facility. We have a board of directors, we have staff and volunteers. So we're very blessed in that we work very closely with Texas A&M School of Dentistry. We've had students come out and they provide care, and our dentists are adjunct faculty. We have a partnership with Tarrant County College School of Dental Hygiene, which is also my alma mater, so I'm pretty proud of that. So we have hygiene students that come in and help treat the patients. And again, it helps offset the cost for the patients. We can reduce the cost to the patient by having these students come in. So it's a wonderful learning opportunity for them as well. We again have the University of Texas at Arlington. We have pre-dental students that come in and help. Both in the clinic as well as in the SMILES school-based program. We have the the Career Tech Center students that again are interested in dentistry that are in high school. They get to come in and they get to learn. And we have very big operatories, which is really nice. So we can have students in there we can have a parent in there, and it's not crowded, so that the dentist doesn't feel like they're sort of suffocating. But we're very fortunate with what we have and the things that we provide. We have several different opportunities throughout the year. We do 2 Give Kids a Smile Day every year, and that is, we do a big one in February when the national one is, and it's basically a free day of dentistry. Last year, we provided over 20,000 worth of free dentistry, again, with 6 dentists and 3 hygienists and several students coming in to volunteer. I think we had about 40 volunteers. Plus, we have a fun day that they go and we had Cinderella here and just different games and balloon animals and things like that. So we try to make it a fun experience for the kids, but we couldn't do it without all the volunteers. So we go into the community. We have several different partners that we're working with. East Arlington Community Foundation. We're working with some of the apartments and going out and educating the parents, letting them know that we are a resource for them, as well as giving the UTA students an opportunity to interact with the community, teach dental hygiene instruction, give them toothbrushes. It's just a lot of fun. So next slide, please. One of the things we were talking about was the social determinants of health and kind of what we do, because it's the same thing. This particular population struggles and they have a lot of different issues. So sometimes they can't make their appointments and you know, sometimes they cry to the dental assistant about something that's happening. So some of the things that we are partnering with within the city of Arlington is we're working closely. They have a VIA program. Arlington's one of the biggest cities in the nation that doesn't have any sort of public transportation. So the VIA program is a new program, and it's an app-based program. So they put it on their credit card, they use their phones, and the VIA vans come around and they stop about on a corner where they can go and pick it up like a bus, and then it takes them to their destination. They just expanded that all over Arlington, but they're also expanding their medical VIA vouchers. So what we do is we get vouchers from the city, and then we can give those to our patients. And the difference between the medical voucher and the dental voucher is they come right to our front door. So they'll take our patient from our entity all the way to their house. And so they can do that as well. So they don't have to pay for it. So that's one of the ways that we're trying to help get our patients to and from when they're having some struggles. We are working closely with the local food banks and with the Tarrant Area Food Bank to develop a questionnaire for our patients and how to ask them in a gentle manner and not too intrusive if determining if they need help and if they're food insecure. Again, it's sometimes that comes out in the conversations, but sometimes it doesn't. So we're trying to be more intentional about that sort of thing. We have the housing department upstairs, so we work closely with them and the Arlington Life Shelter when we have patients that are experiencing homelessness, how we can treat them because they don't have a proof of income or proof of a residency. So we work closely with them. We do chronic disease management. We work with the local FQHCs and JPS Health Network, as well as a few free clinics. Mission Arlington, I mentioned earlier, still has their free dental clinic as well as their medical clinic. So we send our patients over there. Open Arms is a free clinic here in Arlington that also provides for such chronic diseases as high blood pressure and diabetes and the management of that. We partner with the Arlington Independent School District and the Children's Oral Health Coalition and the State Health Services, and we do an oral health improvement program, and we provide education for pregnant teens on oral health for moms and babies, as well as provide care for those mothers. Next slide, please. Oh, I put this in and I didn't mean to do this. This is a presentation that I normally give when I go out into the community, but this is what I ask for when we are going out in the community. We're always looking, for help, obviously, because we are a nonprofit and we're always looking for donors and help. We have different events throughout the year. We do a big casino night, and that helps us pay for the school-based program. So we are always asking for sponsorships and help with that. We're going to be celebrating our 30th year this year. So we're doing a new ribbon cutting. We got all brand new equipment from the Arlington Tomorrow Foundation. So we have all brand new chairs. We moved into this clinic 5 years ago, and it was a very quick turnover. So we moved all of our old equipment and just used a lot of donated equipment. Unfortunately, a lot of times it would break down, and it was very difficult for us to get through the day without having something go wrong. So it was difficult to really be efficient. So we've just recently been outfitted with all brand new chairs. Everything matches. It looks lovely. We have a new vacuum and a compressor, and really trying to step up our game. We are also going into everything is digital. We have the Nomad cameras. We have gone completely digital with everything that we're doing, and moving into possibly getting CAD cams down the road. We do provide every kind of service that they would get in a private practice, our patients. We provide crowns, bridges, partials, dentures. We don't do implants, and we don't do obviously cosmetic things, and we don't do orthodontics. So we do have to refer out for those particular pieces, but we provide everything else. And then also with the school-based program, we do a classification with the students, and we consider them a class 1 when they have severe decay and they're very in pain. And so we try to refer them right back to our clinic, and we try to get them out of pain immediately. We do all of that for free, again, to that particular patient. So we try to have just a complete continuum of care between the two programs. We do the coordinated care for pregnant teens. We provide dental treatment, education to the young pregnant mothers. And we also are starting veteran dental services, providing healthy smiles for our heroes. Next slide, please. And this is my why. Giving every child a healthy smile is priceless. This little guy came to one of our, he was crying and he was very upset. And he finally came to our particular Give Kids a Smile Day. And he was so excited because he got to meet Cinderella, and he got to meet a police officer, and he got to have a balloon thing. And he was just precious. And in the end, he jumped right up in the chair, and he was awesome. So that's why I do what I do. I've sort of come back home. I grew up in Arlington. I went to UTA, I went to TCC. I came back to Arlington, and this is my community. So I feel very invested in how I want to help people. And I love what I do every day. So I know mine is a little shorter, but I thought we could have more room for question and answers. And I think my next slide is just my thank you. Yep, that's it.
Well, thank you, Nancy. We'll get all of the presenters to get back on camera so we can see all your wonderful faces, and Dr. Dhar can begin with her Q&A.
Wonderful presentations, brilliant and informative. Thank you, all of you, for sharing this information with us this morning. We do have a few questions come in. Some of them are specific to each presenter, while some questions are for all of you. So I'll start with the ones that are directed specifically to one of you, and then go with the general questions. So Dr. Cruz, I'll start with you. This is a question for you from Dr. Owens. Do most health centers have dental services in-house, or is it contracted out?
Oh, no, they are in-house. Yeah. Yeah. And I would say, I want to say 99, if not 100% of our health centers have some dental health services. And so they may be in a different building. That can happen just because of locations. I know of some rural sites that have them, down the street, but they are integrated into the service lines.
Perfect. Thank you. The next question is for Dr. Vargas. Is Methodist Healthcare Ministries considered a FQHC?
No, we are private. We don't accept any insurance of any kind. We don't bill Medicaid or Medicare. So no, we are not an FQHC.
Thank you. And as a follow-up to that question, if it's okay with you, Dr. Cruz, would you explain to our audience the difference between a FQHC and a community health center.
Sure. So I had one of the slides up there, and I think it's on the flyer as well, just to, if you want to refer to the specific wording. But there are 4 pieces that make it unique. So health centers, let me start with health centers that are non-FQHCs, just to narrow it down quickly. So those non-FQHCs can belong to larger organizations, typically. Could belong to a health system, like, for example, Parkland has many health centers. Dr. Vargas just mentioned that they have health centers, but it belongs to Methodist. So that's a unique non-FQHC, obviously. So, and that is a charitable or foundation-based organization, as I understand it. So, so those are non-FQHCs. The FQHC requirements are very specific and have a lot of requirements at the federal level. So also different from rural health centers. So I've worked at both. So I'm just going to also briefly say what a rural health center is, different from an FQHC. So rural health center is an independent practice, which may be for profit, but must be in a medically underserved area in a rural designated area. And that those are many that can belong to a private physician's office, or it can be run by a nurse practitioner and supervised by a physician, obviously, and they're rural. So they have less requirements, but also have specific policies and procedures that must be in place for those health centers. So for the FQHC, the 4 pieces are that it must be in a medically underserved area or a health professional shortage area, one of the 2. And then second of all is that it must be that it must have 51% of the members of the board must be from the health center patient population. So that's very unique as well. So that and that one actually no other organization that I know of has that requirement from the federal government. And then the other 2 pieces are that we receive all patients, and we are mandated to receive Medicare, Medicaid, all patients, regardless of ability to pay. Therefore, we use this sliding scale fees, which several of the other partners here also have some sliding scale fees, sounded like. And I think that was, those are the requirements that I mentioned. I think that completes them.
Thank you so much.
Certainly, thank you.
And question for Dr. Vargas. Like me, I believe our audience was also very impressed by the services Methodist Healthcare Ministries provide. So a question was, does Methodist Healthcare Ministry have any services in Houston area?
No, we do not in the Houston area. We do have our service area that I had shown you with my map, but we do serve patients from across the state, so they do not have to be just from the counties that we are serving. If I had a patient come in from Houston, I'd see them. So anyone in the state of Texas is welcome to come here. It's hard to do, to provide services from such a far distance, but having any formal programs there or clinics, no, we do not in Houston.
Thank you. The next question is for Dr. Vargas and Ms. Blinn. So if it's okay, I would start with Ms. Blinn and then we'll come back to Dr. Vargas. The question is there a waiting period for your appointments?
Right now, we do have a waiting period. We're struggling right now because we are struggling with staff and retention. So we unfortunately are pushed out on new patient visits probably about 3 months. And we see walk-in emergencies, and I didn't really get too much into that, but in our dental clinic, we see walk-ins. We have regularly scheduled day of regular, procedures. However, we do take walk-ins every day at 8 o'clock. And so we try to manage them throughout the day. I'm sorry, what was the question again? I apologize. What was the initial question?
Waiting period, which you answered.
Yeah, and so then, thank you. And so those we try to see as many as we can. We try to manage them as much as we can. However, once they come as an emergency patient, then if they want to come back and be a patient of record, we require them to do a comprehensive exam and provide a treatment plan for them. And that unfortunately is pushed out to about 3 months. So thank you.
Thank you. Dr. Vargas?
Okay, as far as patients that are already registered, we can see them, today. I think that maybe like Nancy was saying, at her clinic, one of the problems we're having, to be honest with you, is staffing. So we're having a little bit of delay in the intake or the registration process. So once the patients are registered, we can see them that day. The problem is, just verifying, income and having all the papers that is needed for registration, because we want to ensure that we're treating the patients that, we're here to serve. And so once they're registered, we can see them right away. And we are taking new patients at both of our clinics. Like I said, once they're in, we're ready to see them right away, but a little bit of a lag or delay just due to intake and registration.
Dr. Vargas. Ms. Castillo, there's a question for everyone on the panel, but I will start with you. Do any of you provide or assist in emergency or after-hour dental clinic?
So we do have emergency hours. Typically our school days revolve around from 7:30 to 2:30. We do have a 2:30 to 4 o'clock time period where we designate for emergencies, and we'll see anybody from not just the elementary schools, from the middle school and high schools as well. So we do have meetings and meetings with the school nurses and such to let them know that we're available for them in case they need us for an emergency. Mm-hmm. And also we're not, if it's an emergency patient, the only requirement is that they are a student of the school district we go to. So they do not need to be in a Title I school. As long as they're in need and they need that care, we'll go ahead and see them as an emergency. Typically, we try to get them seen within a few days from the phone call. As far as after hours, currently we do not have any after hours care.
Thank you so much. Dr. Cruz, would you like to answer this question as well?
Could you go ahead and repeat it, please?
Absolutely. Do any of you provide or assist in emergency or after-hour dental care?
Oh, okay. Thanks. So one of our requirements in our policies and procedures is to make sure that there is access to somebody, right, to after hours. So first of all, many of our health centers will have after hours clinics, in other words, including dental, based on the needs in the community. And that's pretty much regularly assessed for each of the health centers. So that's based on their needs of the community it's been identified. Again, going back to the 51% of the board members, and they act as an advisory to the board, obviously, and this would be one way. So other than that, we have a helpline that for every health center for 24/7. So they may not be providing the after hours care in the middle of the night, but somebody would be picking up the phone and directing them to what to do especially in cases where you may have had a procedure, there's a lot of pain involved, maybe the medications aren't helping or the inflammation is so severe. So those are addressed either by phone or as a referral to an urgent care center or emergency room. We try not to do that. The goal is to try to take care of our patients and anticipate their needs so that is not necessary.
Ms. Blinn?
We don't actually provide any aftercare and unfortunately weekend services. However, we do have an emergency line that is answered if someone calls, and then and that would be me. I'm the emergency line, and then I get a hold of my dentist from there and manage as best we can. We're pretty fortunate, and unfortunately, we have said in the past that, if something happens during the night, yes, you would have to go to an urgent care center. But again, we try to manage on the front end, just like Dr. Cruz was saying. So same things.
Right. Dr. Vargas?
We don't have after hours or on the weekends. We do have a call center, and we have our dentists are always on call. We take rotation on call. But we do try to accommodate the emergencies same day, and in almost every case we can same day emergencies for walk-ins for our registered patients.
Absolutely. Thank you so much. Ms. Blinn, can you elaborate on your reservation fee and its effect on no-show rates and patient attitude towards the concept?
Oh, sure. We do the $25 reservation fee. And initially, the patients bucked it. And so now they're used to it. They understand, they know. And so it's just been a matter of explaining that unfortunately we've had a high no-show rate. And if you don't make your appointment, that leaves, someone else who is in pain and needs help. So we try to explain it in a very kind manner and not that we're trying to be difficult. But it just helps them understand that that's the reason for it, so that they know how important this particular appointment is, because the need, it far outweighs the resources. So we try to explain that to people all the time and say, you know what, we're trying to, if we can't help you today, we've got to plug somebody else in there. So we find that our patients are actually pretty amenable to it now, because that's kind of how they're started. Sometimes a new patient may look at us like, what do I have to do? So, but in fact, our patients know now, like they call and they're like, oh no, I got to make my payment, because they actually pay a week in advance for their appointments. So they know that has to be done, or we have to pull them off the schedule. So they're actually pretty good about it. There are a few, you always have the few, but for the most part, that's the policy. We explain it up front, so it is not a surprise and they get it. And when we go over their treatment plan, we explain it again. We phase things out so they understand that we can break it down into smaller chunks, and it just really helps them. And it really, truly makes them, they have the buy-in for it at that point. They value it. And so we have found that it really, really helps us considerably with the no-shows.
Absolutely.
Well, sorry I was late to answer. We are over time, unfortunately, but this was so informative. I thank you all so much. Sohini, I'll let you close us out.
Absolutely. I do see that there are a few other questions, very, very good ones. So I'm sorry for the ones we couldn't get to, but this was such an informative session. Of course, all of us have a lot of questions. We do have the contact information of our esteemed presenters. So feel free to reach out to them, or you could send your questions to Beth, and I'm sure Beth will reach out to our presenters and get the answers for you. It was an absolute pleasure and honor to be here on the panel with this esteemed speakers. Thank you, everyone. And I myself may reach out to some of you because I have my notes. Oh, I need to know more about them. Thank you, everyone. Thank you, Beth, for letting me moderate the session.
You all were great. Thank you so much again.